So by way as context, today's session is designed to increase awareness related to the upcoming changes for MyHealth Records and MyAHS Connect, to review provider experience with results release, and to review possible impacts of the real-time DI report release for patients and implications for pre-test counseling and possible workflow impacts for physicians. With that, we have a lot of information we want to share, and we do want to make sure we have lots of time for your questions. So I'm going to turn things over to Drs. Fell and Dr. Turner to get us started. Thank you.
Thanks, Nicole. So I'm Dr. Steve Turner. I'm the Associate Chief Medical Information Officer for Central Zone, and involved as one of the co-leaders for our portals within AHS. And so what I'd like to do to start with is just give people context about where this information will be and what these portals represent. So in our province, in the portal that is called MyHealth Records, there are two portals that are visible there. One is called My Personal Records, which is the Alberta Health managed information records that we will be speaking about. And then a second portal that is MyAHS Connect, which is the tethered portal that supports care provided to patients within AHS and is available to patients who are receiving care through AHS services or programs. We know that there are a number of other types of portals within the province. Physicians may have a portal system attached with their electronic medical records, and through that they may share information through their local patients through those portals as well. Today we are speaking really about those provincial portals. This is just a quick view of the MyHealth Records portal after you've come through the appropriate sign-ins using my personal identification, my Alberta digital ID, and you have access to MyHealth Records. There are these two tiles, one for my personal records, which is the Alberta Health Records, and then MyAHS Connect, which takes you to the portal that is supporting AHS care and patient contact. So any Albertan over the age of 14 who has an Alberta driver's license or government issued ID is able to register for and gain access to MyHealth Records. That allows that verified account holder then has access to my personal records and to MyAHS Connect as we've described. The MyAHS Connect access is enabled once an individual has accessed care through MyHealth services at a site that is currently using Connect Care. The MyAHS, through the NPR, which we've labeled as light blue just to help with clarity, through NPR, Albertans are currently able to see their lab results, their dispensed medication information that's available to them, and their immunization information. These reports are available without delay, and once that final report is available in NetCare, it is immediately available within MyHealth Records. And we know that, and what we're speaking to today is some of the additional information that will be shortly available in that portal. Additionally, there was other information planned in the future for MyHealth Records, My Personal Records. The other portal that MyAHS Connect I've touched on already is the AHS portal to support care within AHS services and programs. MyAHS Connect currently provides access to information that's in that Connect Care record, the Connect Care record, and that includes lab results, diagnostic imaging results, after visit summaries, care plans, medications that are provided during or prescribed during stays with Alberta Health Services clinics or facilities. And it also provides a messaging service that provides direct interaction with their healthcare teams. In the current state, the diagnostic imaging is available on this portal, as well as endoscopy and cardiology reports, but they are currently being released after a 5-day delay. There may be referral information available in the future on the portal. So I think we can move on to the next slide. So, go back, just to be clear, my personal records, currently DI reports are not currently available, but DI reports are available in MyAHS Connect, but there has been, to this point, a 5-day delay. Okay. So what's changing? Well, as of March 20th, both portals, the following will be available without delay. So general X-ray results, CT, MRI, ultrasound, mammography, nuclear imaging, fluoroscopy results, cardiac angiography and angioplasty reports, and interventional radiology, including injections and aspirations and other types of angioplasties, will also be available through the portals. Remaining cardiology and endoscopy reports that are available within MyAHS Connect that aren't included in that list will still be available, but will still remain with the 5-day delay in MyAHS Connect. And these reports are not yet available in my personal records. So this is just a brief summary of the two portals beside each other, just to identify where their source of information is, whether there's currently a delay, and what is necessary in order to access this information. You can thanks. And I think I'm going to turn this over now to Heidi.
Hello, everybody. So for those of you who haven't met me before, I am Dr. Heidi Fell. I'm a family doctor in Calgary, and I'm the Alberta Medical Association Informatics Committee Chair. So thanks for being here. So we get a lot of questions when talking about this, about why are we making these changes? And the history of this dates all the way back to the Greg Price story, or the HQCA Continuity of Care report in 2013. And in that report, the lack of patient access to information was cited as a large problem for patients within Alberta, and something that we really should work towards fixing. And in that report, a portal for patients to be able to view lab DI pathology reports, etc., was recommended. And in that HQCA report, it also suggests that the ability to see test results immediately drives patient use of the portal. And this was verified through use of some interviews with large organizations in the States and elsewhere, such as Kaiser, Geisinger, and Mayo. In addition, patient advocates have been very strongly in support of real-time release, and patient feedback to Alberta Health has been to request immediate release of more information via MPR. As you may know, they can access, through that, they can access all of their lab results, including pathology and even some genetics reports there. AHS has also received very similar feedback, and their patient portal advisors were strongly in favor of immediate results release. As well, in BC, they've been doing some results release for a long time on the lab side. And in 2015, there was a study from BC that showed that releasing the results without delay increased patient engagement and empowerment regarding their healthcare. So this discussion's been going on for several years now. And in 2019, the Health Information Executive Committee, composed of the bodies you see on the slides there, approved the decision to release results without delay. This was a recommendation to the minister, and the minister subsequently approved that recommendation. Okay. The AMA Board of Directors has also weighed in and approved the release of lab and DI to patients without delay as well. And there was physician engagement during those decision-making processes, as well as patient engagement. And There are arguments to be made on both sides of the coin. However, the reasons that the patients brought, which we'll discuss in a little bit more detail later on, carried the day. And so this is now a provincial directive that patients will be given access to more and more of their information over time in real time. So when we did the lab webinar, when we did the lab results release a year or so ago, we collected some experience from some colleagues, and I also have some personal experience and did even before MPR started releasing lab results in real time with my own EMR within my own practice. And talking to the colleagues, and I now have experience with 2 different portals in my own practice. And what has turned out is that we were all afraid at the beginning that we would get an overload of calls of patients concerned about minorly abnormal results. And on the whole, our experience has been that that didn't actually occur. There is roughly a net balance of calls. So some patients call less now because they can see their own results, and a few patients do call more. So for example, I had a question today come in via my portal about somebody with a low MCV. And it's actually not a bad question because it's related to an alpha thalassemia trait that that patient has. And so something that's probably not a bad idea for them to know about, but something that maybe could have been dealt with at a visit at another day. But I've also found that patients have become more familiar with the meaning results over time. And so as more and more patients have been using the portal, and in fact, this was a new portal user that I was communicating with today, they do get more and more familiar with what's normal for them, what's not normal with them, and they can improve their self-management and involvement in decisions. Okay. I've also found, and many of my colleagues have also found, that we have started to use asynchronous message to replace results review appointments, and now that's a personal preference as to whether that's something you would like to incorporate into your practice or not. But I can take 30 seconds to write a quick message rather than having a full visit being taken up by some of those review appointments. The patients really do appreciate seeing the results and being able to discuss them either within or outside of an in-person appointment. And many patients have expressed to me that they really feel it enhances the trust that we have and the partnership that we have in our relationship. However, pre-counseling and planning with patients is key. I've learned that the hard way. And so if you're telling patients, if you're doing a biopsy, for example, and you're looking for cancer, they need to know you're looking for cancer. If that's a possibility on the test you're ordering, they need to know. You get surprised occasionally, but planning with the patients is key. One of the things that I've found that over time, and I've had months and months to think about this more than you guys have, but one of the things that I've started doing with my patients with lab results is patients that I know that access the portal, I will actually generate a stepwise plan with them. And so I will say, for example, I had a patient with what is probably, rectal muscle spasm the other day. But the plan was he was due for a fit test. We wanted to check his prostate. So the plan was we're going to check these things. Once you see they're normal, then the next step in the plan is that you go see the pelvic physiotherapist. Right? So I started to create plans that are contingent on the patient seeing their normal results, and that helps reduce the number of steps and helps to mitigate the workload associated with some of this. Also, being clear with patients about how you or your clinic review and act on results. So, because of my other duties, I'm only in the office 2 days a week. And so it's important for my patients to know that. Or if I'm doing a biopsy for them, telling them that it will be at least 2 weeks before we get the results in most cases, things like that. So Steve, at this point, I think I'm going to pass it back to you.
Thank you. Yeah, so we're going to go through some of the implications with respect to the immediate release of the DI reports. Some of these questions or concerns came from engagements with with several physician groups early last year in preparation for this release. So we're going to go through and discuss retroactivity of those results, the impact on patients receiving results before the physician, concerns around patient anxiety and clinical workload, look at some information around incidental or soft findings, and then also on radiology recommendations for follow-up. So with respect to the retroactivity in MPR, it's important to know that reports in MPR will only begin being visible beginning on March the 20th, 23rd, 2023, when this reporting is available in my personal records, and there is no retroactivity to reports or information that is that's already been reported. This was at the request of our radiology colleagues, and so information will be available to patients moving forward from that date. There is an additional limitation for new users of the portal. Once we're past the use date, they will see retroactively information that's a DI information back to March 20th or 18 months, whichever is shorter duration. So essentially up until June of 2020, in June of 2023, they would see 3-month history, but by June of 2025, they would only see 18 months back. So it is a forward-looking release of information, and there's no information from prior to March 20th on the My Personal Records portal. Patients receiving results before physicians. So once the DI report is in NetCare, they will be available to patients who are accessing their MPR and their MAC account. We didn't mention it earlier, but with the change on March 20th, MyAHS Connect will also be releasing this information immediately. The MyAHS Connect accounts have had access to their diagnostic imaging results dating back to 2017. But the immediate result release will begin on the 20th. Patients will see these results right after they are available and at the same time or before the ordering provider. We know that providers receive their results as batch feeds rather than immediately or in real time, and so there may be delay before you see those results. We also know that information that has been put on MyHealth Records or MAC sites, there is information on MHR and on the MyAHS Connect informing patients that they may see that report before their provider, and warning them that that is the case, and providers should include information about this timing to their patients as they arrange these tests during that pre-test counseling that Heidi has referenced. When providers can see the result, NetCare patients can see that result as well. Clinicians certainly have expressed concern about potential impacts on their workload and practice as a result of the no delay release of these results. We have not seen that as a substantial impact for the lab release. As Heidi's pointed out, it's been a net neutral. Some patients may experience more anxiety and contact you related to this, but as many more patients may also have their questions answered and their anxieties alleviated by reviewing that result while waiting to have a follow-up visit. Some patients who have received unexpected life-changing results have expressed concern. Additionally, though, we've also heard from our patient advisors and other patient advocates that the early access was although it created anxiety and distress, it was also extremely important for them to get that information and for them to be able to prepare for subsequent visits with their specialist or with the physician to discuss next steps and the implications of that result, and be able to participate in that conversation at that visit, rather than not being able to process that information because of its nature. They express that for them it was valuable to be able to deal with that in the company of their family and other supporters, and so for them it was valuable to see that information as early as possible. There is a concern around incidental and soft findings. Material on MHR sites informs patients that this content is not related to why the test was performed, and if there are concerns, they should speak to the individual who ordered the test. As part of that pre-test counseling, there should be some discussion around incidental or soft findings. Additionally, radiologists are aware that patients will be seeing this information and may change the language they use relative to those findings. In relation to that, recommendations, information on the MHR site advises patients that a report may contain recommendations for additional investigations, and to discuss that again with the ordering provider if they're appropriate for their circumstance, recognizing that not all follow-up is always necessary. You may want to include that information in that pre-test counseling that is done prior to ordering a test. So the pre-test counseling, Heidi touched on it initially, but as a summary, we want to consider how long until you want to make sure the patient understands that there may be a delay between when they see the report and when you do. And importantly, that they will see the result automatically. I think we know from our MyAHS Connect experience that there is sometimes the presumption that the release of the information is at the direction of the physician, and that you have seen the result and released it to them. That may imply that you are providing them information without supporting them. And so it's important that they know that this is an automated process. They will see it, and they may see it before you do. You may want to discuss possible results. We've heard very clearly that knowing what's possible as a result and being honest about the implications of the test, including diagnoses like cancer or other incidental findings, is important to cover before the person has a chance to read that document. Looking for making sure that there are some clear instructions on how your office handles the results, how patients are able to get contact with your clinic and look at counseling patients that they, if there is concern with the result, particularly if it may contain information that has a consequence, that they consider when they look at that result. They may be empowered to decide to not look at the result until they have an opportunity to discuss that with you or with a physician. They may consider, and appropriately, they may consider on which days they look at those results to make so that if there is issues, they do have access to support in the event that they have an issue or a question. Both portals do contain additional information to support patients' understanding of the information that they're receiving. What if I didn't receive or didn't order it? Patients may contact the provider who did not order the test and may not have even been CC'd on the test to discuss that result. Guidance would be that providers need to carefully decide how to handle that situation based on the critical nature of the results in terms of how significant those results are, the need for follow-up, and particularly their understanding of the indication for the test and the implications of the result. Ideally, patients should be referred or redirected back to an ordering provider to review those results so that the context is appropriately understood and explained to the patient. Alberta Health will be providing posters and postcards that can be provided for patients or put up in your offices. Alberta Health has a postcard that's on the next slide that we'll show you. And all of this is available through their help center of MHR, and also through contact at MyHealth Records at gov.ab.ca. And I think this is just the poster that's available. So in summary, as of March 20th, reports for DI and cardio and some imaging for cardiology that involves imaging will now be available on my personal records. Coincident with that, reports for DI and cardiology that involve imaging will also be available in MyAHS Connect but no longer with a 5-day delay for release. And recommendation is to make sure that you discuss the plans and implications of these changes with your patients and take this into consideration during ordering in the weeks to come. And I think we're at questions.
Great. Thank you very much, Dr. Turner and Dr. Isfel. I did not receive any questions in the chat box, but Dr. Fell, I think you did. So did you want to start with the one that you had in the chat?
Sure. Just start with a comment, that recap slide. Just, discuss it with your patients. A very, very trite way to say a very complex clinical judgment, right? And a very complex clinical discussion. So great question in the chat to me. It says, hello, I can understand that a patient looking at cholesterol or low MCV makes few waves. You mentioned a 5-day delay. Immediate release of specific cancer diagnosis on the pathology results ought to be delayed. No matter how much they've heard you mention the possibility of cancer, they are really stressed and suddenly not that calm person you've known for 25 years to not reach me on those couple of days a week when I'm not there. There is added stress to the health system when they've contacted Dr. Googles and the walk-in clinic docs who won't be able to provide further useful info. Can you delay the path report so I have time to make a plan before they show up ahead of their appointment time? So this is a very common concern that we hear about. And the first thing that I would say is that pathology has actually already been being released in real time to patients for the last 18 months or so. So we have already accumulated experience with Alberta in releasing the pathology. The second point is that this is a provincial direction that patients will receive this information in real time. And though physicians generally feel quite a bit of discomfort about this, all of the patient advocates that we've talked to, including, I've had conversations with Terry Price, Greg Price's sister, regarding this myself. And really and also when it's studied academically, a patient's anxiety starts the moment the test is ordered. And so the anxiety continues beyond when they know the test result is back to the very time they start talking to you about it. And so patients want a resolution to that anxiety sooner rather than later. And we have to recognize that many of us are very strapped right now and can't provide timely appointments for patients. And so that's part of the consideration from a patient perspective as well. The other part that Terry Price really emphasized to me was that patients want to choose who they review those results with. And so patients will often gather important family members to them as they read the results, and they will go through the results together And that gives patients the opportunity to hear beyond the C word, because if you've given that information to patients, if it's bad news in an appointment, often, my practice has been to ask them to bring somebody with them, because once that C word comes up, they don't hear anything else in the appointment and they miss lots of important information. And so for patients, that piece was really important, that they can choose to look at it with family or friends, whoever is their support people, and they can use that time in advance of the appointment with their clinician to do that initial processing piece, and to prepare what questions they wanted so that they could make best use of the appointment that they had with their clinician coming up. Now, are you going to run into cases where this is absolute surprise and people get surprised with a life-altering diagnosis? Yes, you are. And no matter how good your pre-test counseling is, that is going to happen. And I want to acknowledge that that's a concern and a fear for all of us, and will be a concern for the patient that affects as well. However, there is the other side of the coin where the patients see things that aren't picked up, or in Greg Price's case, was dropped completely, and chances are he would be alive if he had access to this information. And so when these were weighed, the provincial direction was that there will not be a delay for that information. And so, it is anxiety provoking for us as clinicians. It will be a change for us as clinicians to learn how to deal with this and navigate it. But it is the provincial direction, and there will not be a 5-day delay imposed on any of those tests.
Thank you, Dr. Fell. I just want to comment as well. We did have a few questions and comments that were submitted with the registration process, and Dr. Turner and Dr. Fell did try to incorporate the questions and comments that were sent in advance into the presentation. If you were one of those folks who did provide a question and you wanted to follow up on it, please feel free to do so. The next question we're asked is just, I'll ask Catherine, in terms of the availability of the recording. How will people be able to access that at a later time?
Thanks, Nicole. So we are going to make this available. I believe it's going to be posted to the AMA website and/or Alberta Health's website. And so the links that we provided that FAQ on, I believe, will help guide you there. But we can follow up with the group 2 of registrants once we have the recording available and let you know that it's up, if that's okay, Nicole.
Yep. Yeah, that's good. Thanks, Catherine. Dr. Fell, I'm sure you're seeing this, but in the chat, a follow-up question on the delay and the pre-counsel need. Did you want to just comment further on what Amy's put in the chat box?
Yeah, and it's for any of you, those of you that don't have access to the chat, it's about the fact that this is happening next week, and many MRIs happen months down the road, and so it's too late for pre-test counseling. Fair comment, I think, is what I have to say about that. We did take this to all of the sections of the AMA about a year ago. And so we did try and provide some advance notice that this was coming down the road, but obviously not everybody is aware of it. And so, I think that's fair comment. It's really not possible to provide that pre-test counseling for those imaging tests that you ordered a year and a half ago. And, as Amy also mentioned, that did get a very surprising and likely terminal incidental finding, and we will all have stories about that. We will hopefully, not personally, but hopefully the healthcare system will also have just as many stories about patients that were able to act on things that weren't otherwise picked up or that fell through the cracks as well.
Thank you, Dr. Fell. Maybe over to you, Dr. Turner. Is there a way for a doctor to know if a patient has accessed their records?
That's a good question, and it depends on which portal they access to get that information. So the information that is in my personal records does not tell the physician that the information has been reviewed. If the physician is on Connect Care and the patient reviews their results within MyAHS Connect as a part of the care they're receiving through AHS, that review is identified in the system, and the physician can see that the patient has reviewed that result. And that applies for both diagnostic imaging as well as lab results.
Okay, thank you. A comment from V, the DI reports that include recommendations for further investigations which may not be clinically necessary will put practitioners in a position where patients will demand that such tests are done as per DI report suggestion. This will overburden an already stressed system further, as many of us will just order whatever has been suggested or recommended. Dr. Fell, did you want to comment on that comment from V?
Yeah, I think, another great comment, and this was one that came up commonly in our section consultations when we consulted with the section executives of the various sections of the AMA. I think this is a valid concern, and we raised it with the section of radiology, diagnostic imaging. And that's one of the reasons why they didn't want the retroactivity, because this is something that their section has to learn to adapt to and change to as well. And, this was one of the messages that they received through the consultation process, was that, yes, please be careful with those recommendations, and don't recommend things that aren't necessary, or please put something along the lines of, clinical correlation is required to determine the requirement for this follow-up, or something like that as well. So I expect that we'll see this evolve as the radiologists adapt to this new reality that we'll be facing as well. The other aspect to this is that we have tried to indicate language in the results that patients may expect to find recommendations or things, and that this should be confirmed with the ordering provider. Don't know how much effect that will have, but have tried to address it on the patient side as well.
Thank you, Dr. Fell. And back to you, Dr. Turner. I think you mentioned this, but just to clarify, can patients also access their lab results and other diagnostic tests, or is this only for imaging results?
So currently, both portals provide all of patients' lab results, and that includes pathology results. And that's, as Heidi pointed out, I think earlier, that's been 18 months with my personal records, and been since the MyAHS Connect portal launched in 2019 in Edmonton. So it includes both, and beginning March 20th, it'll include those specific diagnostic imaging tests that we identified Sometimes people perceive results to include things like consult letters or other types of information, and that is not currently available through either of the portals.
Okay, thanks for clarifying. And a question from Leslie about working with specialists. Just confirming, I think that a physician can tell the specialist or can direct a patient back to a specialist to receive a result that a specialist has ordered. Maybe Dr. Turner, you could clarify that was what you said, and then if there's been any consultation with the specialists across the province.
So Heidi can speak to the consultation with the specialists, because there was a fair bit of engagement earlier in the spring, but that was indeed what was said. The person who orders a particular test, whether it's a lab or a DI test, has the responsibility to review and follow up with patients, and they have the best understanding of the context that triggered their need to order that investigation, and they would be the best person to respond to the questions that come from that result.
Yeah, and I would add that we consulted with both the CMPA and the CPSA about these guidelines, and both organizations are very clear that it is the ordering physician that is ultimately responsible for the results unless there is a clear agreement between the physicians otherwise. And so specialty groups are aware of these college and CMPA requirements. We did discuss this in our consultation sessions earlier on. Do they always agree? Not necessarily. And of course, one of the areas of particular concern is emergency departments. And as a family doc, and any other family docs know, we are often asked to provide aid to the emergency department in providing follow-up care to what happened there. I did have a special consultation with the emergency SCN core committee, which includes not just physicians, but also administrators, nurses, other people that work in the emergency department, so that they were especially aware of this. And so are thinking about it as to how this affects their practice as well. Now, and that's especially a concern with the increasing number of Albertans that don't have a family physician to help out in these circumstances, right? And so the emergency departments in particular are thinking about how they're going to fulfill their obligations related to this, but it will be problematic for a few areas and will require adaptation on lots of fronts.
So
Thank you, Dr. Fell. Sorry, go ahead, Dr. Turner.
no, I was just going to say, and relative to that, particularly as the province moves on to MyAHS Connect, or sorry, to Connect Care, the emergency departments have pools that are designed specifically to manage late coming results, and those are supported by physicians working in those departments to review results that return after the patient has been discharged. So a test that's ordered and then completed outside of a particular visit would return to those pools, and those pools are then reviewed and should be managed by those physicians that are part of that emerge department pool.
Okay, thanks for that extra clarity. I'm just going to jump ahead to a question, Dr. Fell, because I think it's an interesting follow-up, but just the concerns or guidance around patients asking nurses for guidance on the results or providing an interpretation. And the question or the comment is that many ambulatory clinics provide nursing numbers as the first line of contact.
Right, and so how that is handled will vary depending on the sort of medical guidance associated with each of those particular clinics. So I know Dr. Turner is planning to do a couple of webinars just for AHS internally based audiences that may help address this more for those particular audiences. For community-based clinics, this very much depends on your clinic policies and awareness of who is answering the phone. So for example, in our clinic, the receptionists are allowed to tell a patient, yes, the test has been seen and reviewed by your physician, but are not allowed to release results. However, nursing staff has more leeway as to what they are allowed to do because they are independently practicing professionals as part of our team that have a scope of practice that may include some of that information. So they're allowed to exercise more of their clinical judgment there. But yes, that's a good point. We have communicated, actually, part of the communication plan for this did involve communicating with the colleges and associations of all the other regulated health professionals in Alberta. So this information is being communicated through their bodies, but I'm not sure what plans they have to communicate this to their membership.
Thank you, Dr. Fell. So just popping back up, there's another question, and I think this is probably the one that is really high on physicians' minds, is that some tests are more sensitive than others. will a patient find out they have cancer before a doctor is able to touch base with them? Dr. Turner and Dr. Fell, I think you both touched on that example and that concern.
Yes, that will happen on occasion. However, Catherine Cronenberg here was talking about a patient advocacy story from earlier today, actually, where if you're looking for cancer, patients want you to talk about that in the pre-test counseling. They say you're going to talk about with them either before or after anyway, so talk about it with them before. But there's no way around those incidental findings where you do a test for some completely other reason and discover, a lung cancer, for example, which I'm sure has happened to most of us that have been practicing for any length of time. And unfortunately, there's no way around those surprises, and the patient may see that surprise before you do.
Thank you. I am not seeing any additional questions in the chat box. I do see, Angela, you've got yourself off mute. Did you have a question you wanted to ask verbally? Angela Juby?
Sorry, I don't have a question. Thank you.
No problem. Thanks for joining us. I don't want to rush through. Just want to give everyone a chance if there are any other questions that anybody would like to ask. Okay, we will not rush you, but I am going to quickly launch an event evaluation. We do this in community engagement. As you heard, we do have 2 sessions coming up for internal staff, and we are always wanting to make sure that we're listening and improving. So please give us your feedback, and you can just private message me in the chat if there's anything that you would like to add. I see Louisa has asked if there'd be another opportunity to touch base after this is launched to the public. Dr. Turner, Dr. Fell, how do you feel about a follow-up conversation?
I'm always happy to have a follow-up conversation if there's concerns. I can be reached through the AMA quite easily, or my email address is fellh@shaw.ca if anybody wants to email me with questions or concerns. On the public awareness question, yes and no. There certainly hasn't been any media campaigns or anything like that. But the public is being informed through various channels, mostly through for MyHealth Records users already. Practitioners will have the opportunity to inform patients as well if they so choose to. But there's already over 1.4 million users of MPR within Alberta. So it's becoming very widely known. It became well known through the COVID pandemic, because that's, even though the pandemic's still going on, but that's where the COVID PCR results were available. And so that significantly boosted awareness of MPR through the province. One other thing to note is that the results do have linkages in them within the program. You can click on a link and see information about what the test is for. And for some of them, there is information about some potential results as well. But of course, that has to be fairly general, because they don't know why you ordered a specific test. But there is information available to patients about what tests are and what they potentially mean, both for lab and DI. Now, obviously, that information is a bit more specific on the lab front than it is on the DI front, but there are supports to patients in that way as well.
Great. Thank you, Dr. Fell. An interesting comment just from Louisa: it'd be helpful to provide guidance to people on what to do or who to talk to when they see abnormal results. Is that noted in there? Talk to your physician. Is that general messaging in that too?
It is, yes.
Okay. Great, thank you. Well, I do not want to rush anyone, so feel free to continue to pop things in the chat or raise your hand or take yourself off mute if you have a question. But in the meantime, just going to go over to Dr. Turner for any final remarks that you may want to make.
So thanks everyone for joining this this evening or this afternoon. Similar to Heidi, you can reach me directly as well. It's stephen.turner@ahs.ca. Happy to take any questions or issues, particularly regarding either of the portals. As I say, I'm supporting the AHS use of portals, and we will be reaching out to our AHS colleagues, both physicians and other clinical staff over the next week to bring them up to date on the change that's in front of us. And certainly a number of the comments in the chat today will be part of what we discuss in terms of how clinics and physicians and clinicians within AHS can support patients as we make this change to immediate release of results in these two portals.
Thank you, Dr. Turner. Dr. Fell, did you want to make any final comments?
No, I just want to thank everybody for being in here and showing your interest in the changes that are happening in the healthcare system here. I know some of us are overwhelmed by all of the changes and pressures that are coming. So really appreciate you taking the time to be here, and please don't hesitate to reach out if you have ongoing concerns or questions that we can help you with in any way. Thanks very much.
I was wondering if I could ask a quick question.
Absolutely, Brenda. What's your question?
Oh, thank you so much for the talk.
Yeah.
I was just wondering if you would be able to link either an email or a website address for us to order some of those postcards and posters that you mentioned. Just want to do that as soon as possible so we can have this before March 20th.
Sure, can we put that in the chat, please, from the slide?
We definitely can. Catherine, are you able to grab that? I don't have it open in front of me.
Yep, let me look for it. And if for some reason you miss it in the chat, then we'll make sure that it is available in the slide presentation that goes out too.
Thank you.
Great, thank you. Good question, Brenda. So just as a final remark, I will reiterate that. Oh, sure, yes, thank you.
Sorry, I went off
Nope.
on my phone. It's Fred Rinaldi. Has this been discussed, like with ICU physicians who order 500 tests a minute?
Sorry, I think I heard you say just if there's been a conversation with the ICU physicians.
So that's a great.
They order multiple tests.
Yeah, that's a great point, Fred. So yes, we offered the opportunity to talk to all sections involved. Can't remember off the top of my head if ICU attended that meeting or not, but they didn't express any additional concern over any other section.
Oh, that's interesting. Okay, thanks.
Thanks.
Yeah, thanks so much, Fred. And if you want to follow up, please do if you have more comments. So I know sometimes the biggest question out of these is what are we going to do with this conversation? As you heard Dr. Turner say, we do have a few follow-ups happening, a few more of these sessions. So if you have internal contacts with AHS, please encourage them to join us for that. We will summarize what we heard tonight for the sake of leadership so that they know what we're hearing from people like yourselves. And then we do have a commitment. We will follow up on any outstanding questions, but from what I've been able to see, I do think we've covered off all the questions. So thank you so much. If you have additional questions, feel free to pop them in the chat or send them to Dr. Turner or Dr. Fell. We'd be happy to follow up with you and look forward to chatting with you all again. Have an excellent evening. Thanks.